Hi, I'm Dr. Michael Latola, and I'd like to welcome you to this clinical update. Today I want to introduce you to a new appliance, or a new update of an appliance. This is the Silent Night SL, or SlideLink, and it's the updated version of our very popular snoring and sleep apnea appliance. In fact, the Silent Night is so popular that we've made over 172,000 Silent Nights since we first introduced the appliance in 1997, and that's at least 2 for every dentist in America, and that's pretty impressive. Let's go ahead and take a closer look at the new Silent Night SL appliance. The design is essentially the same. We have an upper and lower appliance connected together by a strap that's going to bring the mandible forward. But you can tell when you look at the strap versus the old one, there's some big differences. You can see it's not the solid looking strap like we have on the other one, and so it gives us some increased flexibility, which actually leads to increased comfort for the patient. They can definitely get more lateral movement than they could before, and it's an easier movement. They're not fighting the straps as much as they move side to side. Because of advances in the technology for the plastics, these new straps are actually 300% stronger than the previous straps. So even though this one looks to be, big and thick and strapping, like there was no chance that this would break, this whole assembly could in fact break because of the pressure put on it, and the new SL, the SlideLink connectors, are again about 3 times as strong as the old one, so that's an improvement as well. But maybe the biggest deal to us as dentists is the fact that the patient can now change these themselves, because the old system required a Bard Parker knife and some special pliers. It always had to be done in the dental office, but now these are easily done by the patient themselves at home. You can see how simply this comes off. It locks in on the upper one and it slides on the lower one, and one of the benefits of that is it actually gives the patient a little more movement that they've had before in a couple different areas. So you have to actually physically take it off with your fingers to unhook it, but it stays rigidly connected to the SlideLink connector on the upper, and then it'll move on the mandible as you see back and forth like that.